Thanks so much for joining us today. My name is Rebecca Gilbert, and I am APDA's Vice President and Chief Scientific Officer. I'm pleased to welcome you to this web education program designed for people with Parkinson's disease, their care partners, family members, and healthcare providers. I would like to thank Boston Scientific and Lundbeck for funding this important program, and I acknowledge their appreciation for the critical need to provide educational programs like this one to people impacted by Parkinson's disease. During this time of uncertainty, we know that you still have concerns regarding your Parkinson's treatments and in identifying ways to continue to live your best life with Parkinson's disease. American Parkinson Disease Association, or APDA for short, is the largest grassroots network dedicated to fighting Parkinson's disease and works tirelessly to assist the more than 1 million Americans with Parkinson's disease. APDA distinguishes itself as a national organization working one-on-one with the Parkinson's community to make each day better. And now for our program. I would like to welcome Dr. Terry Ellis, Associate Professor and Chair for the Department of Physical Therapy and Athletic Training, Director of the Center for Neurorehabilitation at Boston University, as well as the Director of the American Parkinson Disease Association National Rehabilitation Resource Center in Boston, Massachusetts. She will join me today in discussing treatment concerns in Parkinson's disease. We will both address the top 5 questions that we receive concerning PD medical and surgical treatments and PD exercise. After the presentation, we will open the program for questions from all participants, and please put your questions into the Q&A window during the program. You may view the materials for this program and a printable version of today's slide by clicking on the links below the presentation window. And now we will start our program. Here is a slide of Dr. Ellis's and my financial disclosures. And with that, we will begin. We'll start with my section, top 5 questions about Parkinson's disease medications. And here they are. The first, when should I start a medication for Parkinson's disease? Number 2, what medication should a person start with? 3, what are common side effects of Parkinson's disease medications? And 4, which is a really common question, if levodopa, one of the Parkinson's disease medications, tends to cause so many side effects, should I try to avoid it or delay taking it? And 5, when should I consider surgery for my Parkinson's disease symptoms? So number 1 question, when should I start a medication for Parkinson's disease? And the answer to this question is relatively simple. It's when symptoms begin to affect the ability to function or the ability to exercise maximally. Unfortunately, Parkinson's disease does not have a medication that changes the course of the disease. It does not yet have a medication that is neuroprotective or protects neurons and makes the disease more mild over time. Medications that we have available are symptom modifiers. And so when a person feels that their symptoms are impacting their ability to function, that's when medications need to be started. This point may be arrived at different times for different people. Some people may need their ability to write very significantly, and some others may not. And so depending on what you need to do, that's when your symptoms need to be treated. I want to emphasize that it is also extremely important to be able to exercise maximally, because we do feel that exercise is a neuroprotective element. And Dr. Ellis will talk about this more in depth. We have plenty of research which suggests that this is going to be the best way to protect our brains. And so if a person is limited in their ability to exercise by their symptoms, then they're really shooting themselves in the foot by not getting themselves treated. And so that's a really important thing to keep in mind when considering when to start treatment. Question number 2, what medication should I start with? So a good rule of thumb is taking into account the person's age and other clinical features in deciding what medication to begin with. If a person is less than 70 and does not have cognitive, trouble or trouble with low blood pressure, then there are really three types of medications that are all reasonable medications to begin with. One are monoamine oxidase inhibitors, and in this category are rasagiline and selegiline. The second category are dopamine agonists, and in this category are pramipexole, ropinirole, and rotigotine. And finally, levodopa formulations, and these are precursors to the chemical dopamine, which is missing in the brains of people with Parkinson's disease. Over 70, however, or with clinical elements such as cognitive decline or trouble with low blood pressure, the other medications besides levodopa formulations are typically either too weak or have too many side effects to justify their use in this population. And so we tend to really focus on the levodopa formulations in these patient populations. Question number 3. What are common side effects of Parkinson's disease medications? And so I'm going to discuss the side effects that are most common for the dopamine agonist category and for the levodopa or the dopamine precursor category. Now, this isn't to say that there aren't other side effects that are less common, and it also does not mean that everyone who takes these medications will get these side effects. In fact, most people do not get side effects. If everybody got these side effects, they would not be approved medications. These are side effects that occur in a small number or a subset of people who take these medications. So for dopamine agonists, fatigue is a big issue, can be a big issue, as well as something called sleep attacks, which is falling asleep without warning, and that's something to be aware of when first starting the medication. There are hallucinations, impulse control disorders, and that is something that one needs to be aware of because it isn't something that people typically consider a side effect of a medication, but it can be a compulsivity and an obsessiveness about something. It could be checking the internet, shopping. It could be hypersexuality. And these can actually be a side effect of medication. So people need to be aware of this when they take these medicines. You also need to be aware, especially the people with impulse control disorders, when these medications are stopped because of this side effect, you can actually have a withdrawal syndrome. So these medicines need to be stopped slowly with the supervision of a physician. Levodopa also has side effects. Nausea is a really common side effect. In fact, every single human on the planet would get nausea from levodopa if it were not taken along with carbidopa. So you may see on your bottle of your medication, it doesn't say levodopa, it says carbidopa/levodopa, because that combination helps to prevent nausea in most people, but not in everyone, and so some people still get nausea even on that combination. Fatigue, hallucinations, low blood pressure upon standing, and this is also referred to as orthostatic hypotension, and that is something that can occur specifically with carbidopa-levodopa. You get dizzy when you stand up. And finally, this concept of motor fluctuations and dyskinesias, and that's something we'll talk about a little more on the next slide. So to backtrack just a little bit to try to explain what motor fluctuations and dyskinesias are, let's look at this graph. With each levodopa dose, and a patient typically takes multiple doses of levodopa over the day, the levodopa brain levels rise and then they fall. Early on, these fluctuating levodopa brain levels don't matter. A person feels good with all these varying levodopa brain levels. However, as the disease progresses, there tends to be a narrower range of levodopa brain levels that lead to feeling good, to a good clinical response. So a patient will take their dose, the levodopa brain level rises, but in the beginning, patient still doesn't feel so good. Maybe an hour into their dose, they start to feel good. And then they have a brief period of time where their symptoms are well controlled. A little further along in the day, however, a person might develop dyskinesias or unwanted involuntary movements. As the dose starts to wane and decrease, a person might dip into what's called the off time, where symptoms return, and they don't resume being controlled until the next dose is given. And this fluctuation during the day, where there are ons and offs and some involuntary movements, this can be a very, very annoying and difficult and really problematic problem that people with advancing or more moderate to advanced Parkinson's disease develop. This problem of motor fluctuations and dyskinesias is linked to taking levodopa. If you didn't take levodopa at all, then a person would have no response to their medications. They wouldn't be taking medication. They would have all their Parkinson's symptoms untreated, but they wouldn't have this ups and downs and dyskinesias. And so the next question that is asked very frequently, so if levodopa is associated with these ups and downs and dyskinesias, if levodopa causes so many problems, should I try to avoid taking it, or should I try to avoid, or should I delay trying to take levodopa? Should I be worried about when levodopa is started? So this question is one that's asked extremely frequently. And this trial, which I will go through now, tried to address that very question. Does delaying levodopa treatment affect, and I apologize, I used an abbreviation without explaining the abbreviation, LIDs, or levodopa-induced dyskinesias. And so let's look at the graph below. In this study, 2 sets of patients were analyzed. It was a group of Italian patients. Italian patients typically have treatment that's similar to that given in the United States. It's Western treatment. These patients were typically identified about a year and a half after symptoms started and were given levodopa about a year and a half into their symptoms. And they did really well for about 5-6 years on their levodopa. And about 5-6 years into their levodopa treatment, began to develop this wearing off, the ups and downs, the ons and offs, and the dyskinesias. This is a typical timeline seen in America. However, patients treated in Ghana who do not have access to the same type of Western medicine had a different time course. They typically did not get treated in the beginning 5-6 years of their disease at all. And further into their disease, they received the treatment, much further into the disease, they received the treatment as compared to the Italian patients. And they didn't get levodopa until about 6 years after symptoms started. When they started taking levodopa, 6 years into symptoms, they had only a really brief period where their symptoms were well treated and wearing off and dyskinesia started almost immediately. So this basically means that levodopa-induced dyskinesias and wearing off does not start after a certain amount of time on levodopa. It starts after a certain amount of time with the disease. And so delaying levodopa is not going to affect that timeline. So there is no reason to delay onset of levodopa. What we're really looking about is a combination of being on levodopa, but at a certain point in disease development. And that's really important to understand. And here's another trial that looks at this very similar question and it gets a very similar answer. Here were people who were started on either levodopa or another medication when their disease was diagnosed, and they were followed over time. And after 7 years, whether the patients were started on levodopa or started on something else and then switched to levodopa later when it was more necessary, they had dyskinesias at approximately the same rate at year 7. So again, avoiding or delaying levodopa does not affect the timing of emergence of dyskinesias. And the last question of my 5, before I hand it over to Dr. Ellis, when should I consider surgery for my Parkinson's disease symptoms? And so good candidates for surgery are pretty well established, and you need the following. You need to have an excellent response to levodopa. That's really important. If you do not have an excellent response to levodopa, the surgery will probably not work. The second thing that you need, or that is something that to consider, if it's a symptom that you have, you should consider surgery, is motor fluctuations and dyskinesias, that combination of on and off time and dyskinesias that can't be managed with medication adjustments. And there are many medication adjustments that can try to help that scenario, but if those medications adjustments don't work, surgery can be considered. Another possibility for the use of surgery is a tremor that is not responsive to medications. In those 2 clinical scenarios, the surgery can be considered. One should also note that cognitive problems and balance problems are considered issues when considering surgery. And if you do have cognitive issues or balance problems, surgery may not be for you either. And so those are some things to consider when thinking about the surgery or deep brain stimulation for Parkinson's disease symptoms. On that note, I'm going to turn over the mic to Dr. Ellis to answer the top 5 questions about exercise for people with Parkinson's disease. Terry, all yours.
Okay. All right. Thank you, Rebecca. That was great. Very helpful. All right. I'm going to switch gears a little bit and talk about the top 5 questions that I get about exercise. So let's dive in here. So here they are. What is the best type of exercise for people with Parkinson's disease? Does the type of aerobic exercise matter? In other words, what's better, the treadmill or the bike? And then how do I know how much exercise to do? And what if I can't exercise for 30 or 45 minutes all at once? Does anything help? What kind of exercises can I do in my home? And that is a particular popular question right now. Okay, so let's start with the first one. What is the best type of exercise for people with Parkinson's disease? Well, it's not so simple. The answer is it depends. And so there are many forms of exercise that are beneficial for people with Parkinson's, including here on the left, in the left-hand column, aerobic exercise. So that's cardiovascular exercise in which you're sweating and a little bit out of breath. And then there's resistance exercise or strengthening exercise, and that includes weight training, either using weights or machines or body weights, those sorts of things. Balance training, in which we're trying to improve overall balance, and stretching or flexibility exercises. So here are some examples in the middle column. So by aerobic exercise, that could include brisk walking, stationary cycling, parts of boxing can be considered aerobic exercise. And then, like I said, the weight training could be machines or body weights or free weights or elastic bands. And the balance exercise could consist of, things like standing on one leg, for example, or things like Tai Chi or dance. And stretching would consist of things like flexibility exercises or yoga, for example. So what improves? So over in the last column, you could look at this last column and say, well, what do I want to get out of exercise? How do I want the exercise to help me? And if you're looking for better fitness levels, better cardiovascular fitness, then aerobic exercise is going to be most likely to do that. The other thing is that when Rebecca alluded to the kind of exercise that may be neuroprotective or we think might have a disease mitigating effect, that has been shown mostly in studies with aerobic exercise. So, getting your heart rate up, high intensity aerobic exercise, that has been shown to lead to a decrease in motor symptoms. And then the resistance exercise or strengthening exercise, you can expect to feel stronger. And there's also some evidence to show that the strengthening exercise can help reduce the bradykinesia or the slowness of movement. The strengthening exercises also can improve balance. If you go down here to the balance exercise, what you can expect to see from balance exercises are improved balance and a reduced fall risk. And then down at the bottom here, with stretching exercise, you can expect to see improved mobility and decreased stiffness. So you can ask yourself, what are your main goals? What do you want to get out of exercise? And if you look here in the last column, this will help you decide, okay, depending on what my goals are and what I want, this is the kind of exercise that might be best for me. Okay. And then another common question I get is, all right, if I'm going to engage in aerobic exercise or cardiovascular exercise, does it matter which one I do? Does it matter if I do walk on a treadmill, for example, or ride a stationary bike? And there have been 2 large trials done to look at this. One of them is called the Sparks trial, and they looked at about 130 people with Parkinson's disease, And they engaged in high intensity or moderate intensity treadmill training. That's brisk walking on the treadmill. And then a study that just came out in the past year, this was the Parkinson Shape trial that came out of the Netherlands. In this study, they also looked at moderate to high intensity aerobic exercise, but this time it was done on the bike, so stationary cycling. In both studies, people with Parkinson's engaged in either the treadmill training or the stationary cycling 3 times a week for 6 months. And in both studies, the results showed a decline in the motor symptoms. So sort of less worsening of the motor symptoms in those people who engaged in this exercise compared to people who got usual care or didn't exercise, for example, or exercised at a very low intensity. So these results suggest that it's not really the mode of exercise that seems to matter. So it doesn't matter whether you do treadmill training or cycling to try to reduce the symptoms of Parkinson's disease. The effects were shown no matter what type of exercise was chosen. The key here, though, does seem to be intensity. Intensity seems to matter. We're still not 100% sure what is the optimal intensity. In fact, there's a trial, the Sparks trial. There's going to be a subsequent trial, the next step of this trial that's coming up, that's going to look into this further to try to determine, sort of the optimal intensity. Can it be moderate or does it have to be high intensity? Okay. One thing to consider with this when you choose whether you want to engage in treadmill training or cycling, first is to ask yourselves, well, which one do I enjoy more? Because in order to benefit from exercise, you've got to stick to it. And so whichever one you're going to stick to more is going to be the one that's probably best for you. There's a couple of other things to think about too, though. With treadmill training, there also tends to be improvements in walking that are associated with treadmill training. With cycling, not so much. We don't tend to see the improvements in walking necessarily. And that's because in treadmill training, people are training walking. They're practicing walking. Whereas in cycling, there's no walking that's done as part of the cycling task. So if you can walk on a treadmill safely and you want to improve your walking, then the treadmill training might be a good choice. However, if you have difficulty walking on a treadmill, or you have freezing of gait or balance problems, then the cycling might be a safer option. Okay, so then the third question, how do I know how much exercise to do? Well, here are the recommendations for each type of exercise. So for aerobic exercise, it's recommended that people do about 150 minutes a week, which is 2.5 hours a week, which turns out to be 30 minutes, 5 days a week of at least moderate intensity exercise. So now in the studies I just showed you, they showed that people had a benefit of exercise, the aerobic exercise, 3 times a week for 30 minutes. So I'm going to say that although these are the general recommendations, there are benefits of 3 days a week for 30 minutes. The resistance training or the strengthening exercise, it's generally recommended that these are done 2 or 3 days a week. That's the same with the balance exercise, about 2 to 3 days a week. The flexibility or the stretching exercises, that can be done as much as you want, at least a couple of days a week, 2 or 3 days a week, but that's something that could be done every day if it makes you feel better. Now, some people ask me, how am I going to have time to do all of these exercises? This is a lot. Well, some of these things can be combined. For example, there are certain exercises that you can do that combine, that have a benefit for both strengthening and balance, for example. So there's ways to consolidate this. And like I said earlier, if you do treadmill training, you can be working on aerobic exercise and walking at the same time. So there are ways to combine or chunk these so it's not so overwhelming. Okay, what if I can't exercise for 30 minutes or 45 minutes all at once? Well, there's good news here. You definitely want to start small and gradually increase the amount of exercise you do over time. This is particularly true if you haven't exercised or you're not an exerciser and you're just beginning. And what this little picture here shows is that even a little bit each day that's gradually increased over time can make a big difference after 6 months or a year or so. The other good news is that you don't have to do it all at once. There are studies showing that although 30 minutes of walking, for example, is great, there are benefits to doing even 10 minutes of walking. So 10 minutes of continuous walking. So that can be done even in your house. If you're walking, laps around your living room or back and forth into the kitchen or down the hallway back and forth, even just 10 minutes of continuous walking, people can see benefits. Okay, and then lastly, the most common question we're getting in the last month or so is what kind of exercises can I do at home? Well, we have contributed here to this book called the Be Active and Beyond Exercise booklet, which you can get for free on the APDA's website. And in this book, there are strengthening, balance, and stretching exercises, and even some information on how to do aerobic or brisk walking exercise. And the beauty of this is that you don't need any equipment. This was designed for people to be able to do at home with no equipment, very inexpensive. In fact, you can download this for free. It's very convenient. And we've also included here different levels. So there's a level 1, 2, and 3. So if you're just new to this, you can start at a level 1 and get started and then progress over time. Or if you want to be more challenged and you're already exercising, you may be able to start at a higher level, a level 3, for example. Here are just some of the pictures that are in the book. So you can see here, these are flexibility or stretching exercises. This gentleman here is stretching the hamstrings, the muscles in the back of the thigh here. And then this woman here is stretching the muscles in the front of the hip flexor muscles, which often get stiff in people with Parkinson's disease. And then this gentleman here is stretching his calf muscles in the back of the leg, which can also get stiff over time. And then here's just a simple example of a strengthening exercise. This is just a squat. And you can see here in the book, you can see there's different ways that you can do a squat. There's ways to make it easier or harder. But this is just using overall body weight to lift your body up against gravity, and that really works some of the back muscles and the big extensor muscles in the legs. In the book, it also shows things to avoid to make sure that you have good form and the quality of the movement is good. And there are other examples too, like here's just a simple push-up where you could use the kitchen counter, for example, so that you can do this right in the comfort of your own home. And then if you're really ambitious, there are other things you can do at home. You can, if you want to try dance, for example, you could move the living room furniture out of the way. And this is a picture of tango. There's been actually quite a few studies in Parkinson's showing the benefit of dance. And so that's something that you can try at home. There's also Tai Chi is another thing that can be done pretty easily at home. And then also brisk walking. Although things have changed, it's still okay to take a walk outside as long as you're practicing social distancing. There's also a link on the APDA's website under the COVID-19 tab that has links to exercise programs that are being delivered around the country remotely or virtually, so that you could even tap into an exercise program that's being delivered in real time and do this right in your own living room. Okay, and with that, I think we're going to open it up to questions.
Fantastic. Thank you so much, Terry. So it is now time for our question and answer session. Before the operator gives instructions to submit your questions, I'd like to remind you that we have hundreds of people listening to this. So for everyone's benefit, please keep your questions general in nature, and we will provide an answer that is general in nature. So operator, can you please give instructions to our participants so they can ask a question?
Yes, thank you. Please do type your question into the Q&A box that is located to the right of the slide window. One moment, please, while we poll for questions. Thank you.
Okay, can we get started? All right, let's get started. We have a whole bunch of questions that have come in already. And so our first one, I will take the first one. At what point in someone's diagnosis do you recommend the brain stimulation procedure or deep brain stimulation? So just to review for those who may not be familiar, deep brain stimulation, which I referred to in my talk, my question number 5, is a surgical procedure for Parkinson's disease where a thin wire is placed deep into the brain, left in the brain in a very specific deep brain structure, and the wire gets tunneled out of the brain, under the skin, and gets attached to a sort of battery pack / computer which sits in your chest, much like a cardiac pacemaker. The entire system is under the skin. No one can see it, but it is permanently there, and it supplies electrical impulses to the brain, which evens out or regulates the circuitry of the brain, which may be abnormal in Parkinson's disease. And so the question is, when do you consider that procedure? So what's important to remember is that what you need is a good response to levodopa. So definitely a person who needs already to be on levodopa so they know what their response is to levodopa. And some people may walk into my office and ask for the surgery right away on when they're first diagnosed, and that would be too early because we do need to get a sense of what the response is to the medications as a really important guide to whether the surgery will be helpful. Another thing to consider is whether all medication options have been considered, because, of course, the surgery can be quite helpful in the right clinical scenario, but it is a surgery, and typically we do want to try the medication options first, and so that is something we think about before we refer to surgery. Are there other medication changes that can be implemented? But there are people who have tried a whole bunch of different medication options, and those medication options are not helpful enough, and they do want to pursue the surgery. And so again, the type of people who do best in the surgery are those that have the fluctuations, the on and off fluctuations and the dyskinesias, or, and this was another question where I may not have been clear, the person needs to have either the fluctuations and the dyskinesias or a tremor that's medically refractory, does not respond to medication. Those two clinical scenarios are the most common reasons to proceed for surgery. So hopefully our question from Shannon has been answered. The next question is from Sheila, and I will ask Terry if she can answer this. Can you explain why aerobic exercise slows progression aside from just the benefits one might get from improving their fitness level?
Great, that's a great question. We are still trying to figure out what the specific mechanism is that actually explains that. There are some hypotheses. For example, it's thought that the high-intensity aerobic training might increase the amount of neurotrophic factors, or these chemicals in the brain that help protect the sick cells from dying, for example. So these things, you might have heard of BDNF, for example, or GDNF, some of these chemicals that, if you elevate the level of those chemicals in the brain, that might be one way that might slow the progression of the disease in people with Parkinson's. But we're not sure. These are some of the things that are still being investigated in some of the exercise trials, that we have going on and that will be going on in the future.
Excellent. Thank you so much. We'll take another question about deep brain stimulation, this one from Christina. What kind of medication changes do you expect post-deep brain stimulation, and what drives a successful deep brain stimulation surgery? So what's important to note is that we do deep brain stimulation not for the purpose of lowering medication. So there should not be an expectation that medications will not be taken after the surgery. So typically, however, the levodopa dose is lowered after the surgery, but not always, and it should not be a sign of failure of the surgery if that doesn't take place. Really, we're looking for quality of life and functionality outcomes and not amount of medicine taken. But typically, levodopa dose can be lowered after the surgery. And again, in order to maximize the chance that deep brain stimulation will help, you do want to fit into those categories we discussed earlier and want to make sure that the patient does not have cognitive problems and has good balance. With those two elements, you can ensure a better outcome. So we now have another exercise-related question from Marilyn. I do boxing, which stresses the quickness of one movement, so ability to move more quickly. Can you explain the benefits of boxing to me?
Sure. That's a great question. There are not a lot of studies on boxing per se, and the studies that do exist tend to be very small or tend to be case studies, or they have they're not controlled studies. However, if we look at some of the elements of boxing, we can draw from other aspects of exercise. For example, there are elements of boxing that challenge balance, for example. Changing directions, the quick movements of the feet, and that can definitely help with, improving postural control or balance. There's also a strengthening element to boxing. Hitting the big bag, for example, can help improve strength. There's also an aerobic component to boxing. People are working hard, sweating, getting a heart rate up, and so when you look at the boxing class overall, if you're doing a boxing class that's 45 minutes to an hour in length, there's part of it that's, challenging balance. Part of it is challenging, strengthening or resistance training, and part that's targeting aerobic training. So those three elements there can help, like I showed you in that previous figure, can help improve some of the symptoms of Parkinson's disease.
And one thing that I find for my patients that do boxing classes is the camaraderie that comes along with the boxing class. It's an added benefit as well, not directly exercise related.
That's absolutely right.
Yeah. So we now have a question from Priscilla. This is a question that addresses something we didn't really touch on at all in our webinar, but is something on people's minds, I know, which is, are there any new updates on stem cell regeneration for Parkinson's disease? So what this refers to is a whole branch of medicine where different types of cells, and there's a whole array that are being studied, are actually placed back into the brain to help replenish the dopamine neurons that die in Parkinson's disease. This is an extremely complex topic, and it's not something that I can answer sort of in 1 minute, which is the kind of timing that I have here. So I just want to let you know that on our website at apdaparkinson.org, if you search for the word stem cell, you will find an article that goes into much more detail about the various stem cell treatments that are under development and their pros and cons. So that would be, if you're interested in this topic, that would be the place to look. The general consensus is that, yes, there are multiple labs around the world who are working on this particular problem, trying to find the right type of cell to place into the brain. It's obviously an extremely difficult thing to do. The group that's probably ahead in this quest is a group in Japan. They are actually in clinical trials in humans right now. It's going to be a very small trial. I know they've already enrolled one person. They may have enrolled more than one. Their goal is 7 people, and they are placing a specific type of stem cell into the brain and then seeing the result. Many other groups are not quite there yet in terms of putting their stem cells into people, but there are many groups on the tail of the Japan group trying to perform these type of procedures as well. The real issue is control of the cells once they're in the brain. So we can make stem cells relatively easily in various different ways, and we can do that well in a petri dish. We can put them into the brain relatively easily. We know how to do that in terms of the surgical procedure. The question is what happens to those cells once they're in. Are they going to engraft correctly? Are they going to make the right connections with the other neurons in the brain correctly? Are they going to grow too much and cause problems in and of themselves? So that's really the issue that people are focusing on, control of the cells once they're injected into the brain. So there's a lot more work to do, but certainly excitement. And what I should mention is that the stem cell procedures that you might see advertised around the country, around the world, you really, really want to make sure that any surgery that you've signed up for that involves stem cells is part of a clinical trial that is IRB approved. That means reviewed by the internal workings of an academic medical center to make sure that it is really safe and that all the protocols are followed. There are many people doing stem cell treatments around the country which are not regulated, that are not FDA approved. It really is the Wild West. You have to be super careful when it comes to stem cells. Talk it over with your physician if you are in the least bit unsure about something that's being advertised to you. All right, next question, again about exercise. What kind of exercise is appropriate for someone who has had a hip replacement?
Okay, so somebody that's had a hip replacement is going to really need to focus on the strengthening or resistance exercise, particularly those that target the big muscles in the legs, the hip muscles, the muscles on the front and the back of the thigh. And so there are, specific exercises that can be done, even some of those in the Be Active booklet. But whenever you have something else going on other than Parkinson's disease, and you want an exercise program that targets both things, then I would suggest that seeing a physical therapist is highly recommended, because what you really want is an exercise program that's specifically tailored to your needs to make sure the exercises are getting at exactly what you need to get at, given your specific, individual circumstances. I know right now it's difficult to go see a physical therapist. There are some physical therapists that are doing telehealth calls right now, so some telemedicine. So we can help you find somebody. If you want to contact us at rehab@bu.edu, that's our helpline, our APDA helpline. That's our email contact. We can help put you in touch with a physical therapist that might be able to help you with this, even if you can't go to the actual clinic to see a real person.
Great, fantastic. And there's actually another exercise question that I know that people are hearing a lot about, the big and loud exercises. Terry, can you comment on how effective those programs are?
Okay, so for the loud program, there's so this is the speech program in which you focus on, taking some speaking loudly and really projecting your voice. There's actually quite a bit of data to support that, showing that people with Parkinson's benefit from an intensive program focusing on speaking loudly. However, on the big side, the big movements, there are many fewer studies that have actually tested the benefits of moving big. Now, it sort of makes sense because people with Parkinson's move, and generally the movements tend to be small. So moving, sort of training yourself to move with big movements, can be beneficial. But it's definitely not the only thing. So just like when we go back to the key aspects of exercise, I would encourage you, if you're doing that program, to also think about, okay, what about working on my walking, or working on, what about the aerobic part of the exercise? What about, the strengthening parts of the exercise? So again, there can be benefits, but it's not the only option.
Fantastic. Next question is, are there any cognitive exercises that target PD patients who present primarily with cognitive changes? So this is an excellent question, and something that people with Parkinson's disease struggle with, cognitive challenges.
Go ahead, sorry. Yeah, go ahead. Well, there's a couple things to think about. I mean, there's two sort of, you can come at this from, I think, multiple different angles. And one of them is, okay, what about physical exercise? What are the benefits of physical exercise on improving cognition? And there's actually quite a bit of data to support the benefits of aerobic training. So brisk walking, for example, or that stationary cycling can actually improve some aspects of cognition. There was one strengthening study, even resistance training, showing improvements in cognition in people with Parkinson's disease. There's also cognitive exercises that can be done. So thinking exercises those have been sort of understudied, but there is, a little bit of evidence to suggest that, challenging yourself in the thinking domains can also have some benefit. Rebecca, I don't know if you were going to touch on any other aspect of that, medication or
Yeah, no, I think that's really, really important to note that people think about cognitive issues and they get so worried because the feeling is, oh, there's nothing I can do. It's not in my hands, and it's just so terrifying. But I think it's really important to really emphasize what you're saying, which is that we do have evidence that physical activity and exercise can help with cognition. So people really do need to keep that in mind and not despair, and focus on what they can do to help improve their cognition. And then the question is, are there any non-physical things one can do to sort of exercise the mind? And this is under a lot of research as well. Are there particular puzzles or other mental strategies that can improve thinking? And my general feeling is the more your brain does, the better your brain is going to be. So physical activity, social engagement, mental stimulation, really all conspire to help. And so that's where we can put our efforts to help people with cognitive issues. Mm-hmm. The next question is about the DBS battery. Do the new DBS batteries have a longer life than those used previously? So the biggest difference in DBS batteries between now and in the past is that we now have rechargeable batteries, which means that a person can use their battery typically through the week, and then once a week wear a little rechargeable device that they wear close to their where the device was implanted in their chest, and they wait a certain amount of time as the battery gets recharged, and they're good to go again. And so using this periodic recharging method, that battery can stay in the chest for much longer than previously. So that's something to discuss with the neurosurgeon who you might be meeting with to discuss the different deep brain stimulation options. There are a number of systems that are available. Some of the systems offer a rechargeable option, so that's something to discuss before the surgery in deciding which system to put in place. We now have a question about freezing of gait. So the question reads, my husband does not have tremors, but has freezing of the legs, especially when going through doorways or later in the day when he is tired. So I'll answer the medical management of freezing of gait, and then Terry, I'll pass it to you to talk about
Sure.
some of the exercises about freezing of gait. So freezing of gait is a real difficult problem that both Terry and I see a lot of, and it's an issue which you can, I'll try to make it a visual problem that people can think about. As a person is moving forward, their feet do not advance, so they may take multiple steps in place. Their torso may want to advance, and so their torso starts to advance, their feet are stuck to the floor, and that, of course, can be a really big fall risk. And as the question implies, freezing of gait is typically brought out when a person is changing their pattern of walking some way, going through a doorway, trying to step on an elevator, going around a turn, going around an obstacle, and that's when the freezing comes out. And so if this is a problem for you, one of the things you might want to discuss with your neurologist is adjusting medication. Sometimes this problem happens when a person's Parkinson symptoms come out, they're in their off time, their medications are waning, and so adjusting medication so you don't have that off time may help to improve freezing of gait. But I'll pass it to Terry about other ways to address this problem.
Yeah. This is a very challenging problem and one that we do see all the time. There's some sort of tricks or cues that people can use to try to prevent the freezing from coming on or to overcome the freezing in a given moment, like starting the walking process or going through a doorway or into a narrow space, for example. There are visual cues, and this can be in the form of putting some tape on the floor that's a certain distance apart, and those visual cues can help help people navigate through that tight space. Focusing on their attention on those visual cues and stepping over those lines can sometimes reduce the freezing in a specific area. Freezing that happens with sort of general walking, kind of after people have been walking for a while, that tends to respond better to auditory cues or a metronome or music, for example. So we figure out the sort of optimal sort of beat to set a metronome to, so that somebody that freezes can map their pace of walking onto the beat of a metronome, which can help keep the steps big. So by keeping the steps longer or bigger, then people are less likely to then have smaller and smaller steps, which can sort of trigger the freezing. So this is another really good example of something that a physical therapist, going to see a physical therapist either in person or via telehealth, can be really effective. Especially now when via telehealth, we're doing some of these visits where if I can see someone and see where they're freezing in their house, we might be able to intervene right in that moment and say, okay, here's some things you can do to reduce the freezing. Because it does tend to happen in very specific situations in the home. And so some of these sort of tricks and tips can really make a big difference.
Fantastic. So next question from Julie. Any nutritional recommendations for a Parkinson's patient that are different from nutritional recommendations in the general population? Excellent question. And the answer is we don't have a specific Parkinson's diet. Many people have looked doing clinical trials of various supplements to try to see if specific supplements help with Parkinson's disease progression, and none of those trials have reached a point where we can recommend a specific supplement for Parkinson's disease. There have been studies on brain health, and so probably the best diet for the brain in general is the Mediterranean diet. That's a diet that emphasizes low-fat proteins, vegetables, nuts, olive oil, legumes, and avoids processed foods, carbohydrates that are not whole grains, etc. So that's a diet that has been studied formally in cognitive issues as well as in general brain health, and is a good diet for the brain. And so we tend to recommend the Mediterranean diet for our Parkinson's patients. We now have a question from Gwen. And she's wondering where you can see a list of trials about Parkinson's disease. This is an excellent question. The best place to look at clinical trials, the most comprehensive, is clinicaltrials.gov. So the word clinicaltrials.gov. This is an extremely comprehensive clinical trial database from around the world, and you can search Parkinson's disease, and it will bring up all the trials in Parkinson's disease. Word of caution, however, is that this list is not vetted. So if something is on the list, it does not mean that the NIH approves this trial. All it means is that somebody submitted to this database. And so even if a trial is in the clinicaltrials.gov database, you want to take that information to your physician, make sure this is a trial that is above board, and it would be a good trial for you. And I think this may be our last question. And of course, there are many that we haven't gotten to. We are aware. Let's take this question and see where we are. And this is a question around respiratory volume. After 6 years of diagnosis, I become breathless more quickly with moderate intensity exercise. What would you suggest? Terry, you want to take that, and then I can maybe add some my own thoughts.
Yeah, there are actually some more recent studies showing the importance and the benefits of, deep breathing exercise to help with respiratory volume. Even sort of breathing into something called a spirometer, something that provides a little bit of resistance when you breathe into it, is another way to sort of help to improve respiratory volume and strength. We also that can also help people have a productive cough, a really strong cough, which is also important in Parkinson's disease. So again, there are various things you can do, and I see that you're talking about having some moderate truncal rigidity, so a physical therapist could help look at that to look at the different positions that you might be able to do the respiratory training in that would be less problematic related to the truncal rigidity, so that you could get the most sort of expansion possible and have the most benefit.
Fantastic. And something else to consider would be if there is truncal rigidity that is getting in the way, perhaps a medication adjustment may be helpful as well to allow you to do those exercises that Dr. Ellis was referring to. So I think a combination. But I think it's really important to know that there are things one can do if one is feeling like short of breath. Any part of the body that can be exercised can be helpful in breathing as well. So that is going to close our question and answer session. Thank you so much to Dr. Ellis for joining us today, and my many thanks to everybody who is on the webinar today for participating in our education program. I apologize. I see there are many, many more questions. We could not get to all of your questions. If you have a question or would like to speak with someone from our Scientific and Medical Affairs Department, I encourage you to visit our website at apdaparkinson.org or call 1-800-223-2732. If you enjoyed today's webinar, we hope you consider supporting APDA with a donation. And with your help, especially in this time of COVID-19, APDA can deliver more programs and services like this one, and we need them now more than ever. I'm sure everyone will agree. I want to thank again Boston Scientific and Lundbeck for their generous support of today's program. To join us in this fight against Parkinson's and to learn more about the support APDA provides across the country through our network of chapters and information and referral centers, as well as our National Research Grant Program and our Centers for Advanced Research, please visit us at apdaparkinson.org. We all agree that being informed about your disease and treatment options is the best way to empower yourself and take control of your care. Have a wonderful day.